India is in the midst of a COVID-19 disaster, with over 400,000 reported new cases on Thursday, surging the country's total past 20 million. Yet, with hospitals desperate for oxygen, the government is saying there's no shortage of the life-saving substance. The second wave, and experts concerned that it could also be affected by new virus variants, has also caused concern the world. Why did India fail to prevent the wave? How are they working to bring the chaos under control? And how worried should the world be about these new variants? To discuss this, I'm joined in Beijing today by Dr. Feng, director of Tsinghua University's National Strategy Institute. Director Qian, great to have you with us. India reported, as we heard on Thursday, 3,980 virus deaths. Why did this happen?
Yes. Okay. Yes. We just find the confirmed death case now is on a record highs, and the India's the rate nearly equal. Yes, equal ranking world second. Yes. So why cause so the outbreak of the second wave of COVID-19, yes, I think it's not, yes, except the poor, the medical infrastructure, yes, and also a lot of reasons. The reasons, yes, everybody knows, yes, recently, yes, we find a lot of political activities, and especially the religious and the political assemblies. And the government is lose control, and the second I think is the reason is because of the invasion of the vaccine, yes, and because of a decline of the cases, and for the government and the normal people, they just lose vigilance about the outbreak. And third is, I think, is now from the central government of India and also the local government, they are very urgent demand of recovery of economy. Yes, so lot of measures to control the pandemics. Yes, seems to be a formality. And
sure, there are lots of factors contributing to this tragic loss of lives and surging cases. Narendra Modi, India's Prime Minister, is reluctant to impose a nationwide lockdown for fear of economic fallout, as you have indicated. The Indian government also requested that Twitter take down dozens of tweets that are critical of the country's pandemic response measures last week. How do we look at the Indian government's response to all this?
Yes, okay. From that case, we can find, yes, on the one hand, the Modi government now is feeling more pressures at home and abroad, yes. And the second reason is now under the current severe situations, there are a lot of rumors and also truths, yes, numerous. So the governments want to take strict measures to control, yes, to stabilize the society, and yes, to avoid further interference, yes, against the government work. For Modi's response, I think is okay. Yes, it's okay. But ironically, yes, Modi has his what known yes politicians have a lot of followers, a lot of fans. There were millions fans in the Twitters. But why he choose that kind of strict measures? So it reflects the Modi government in embracing position. Yes, had no other choice.
Yeah, it's a truly tragic situation on the ground, Director Chen. I want you to hold on for a second because we want to show you this story that was done by our reporter. As the crisis in India is growing, India has had an emotional toll on families. A shortage of oxygen and hospital beds mean they've had to search for a place for their loved ones to be treated, with some dying during the search. Bhavin Goswami reports.
India continues to break records for the number of new COVID-19 infections reported in 24 hours. With over 390,000 new cases on Sunday, India's healthcare system is in a state of collapse. Family members are desperately searching for the care their loved ones need to survive.
We are in so much tension, they are not guiding us properly.
As people have been left out to die outside of the hospitals. Patients are being turned away due to a lack of beds and oxygen.
At that time, my mother's situation was terrible, and I begged them to please admit her, but no one admitted her, and she's gone. What will they do now?
And inside the hospital, the situation is even worse than ever.
Our supply of beds and oxygen is getting lower. In India, the situation is really bad, and it is going from bad to worse.
Over 3,500 deaths were officially recorded in the past 24 hours. But the real figure is thought to be far higher. As the situation worsens, people are trying to help each other on their own. We can see a number of healthcare worker camps on the streets of Delhi where they're providing oxygen to the patients and trying to normalize the situation for some time.
If we help people and work together, there's no problem, but don't misguide them. People are going for treatment. We should help them because we also can face the same situation. We can find where we can get oxygen. We are trying to normalize the situation. We don't have any doctor here, but we are helping as best as we can.
Due to this situation, cremation is also a problem. Where they usually cremate 10 bodies a day, they are seeing up to 90 bodies per day. And people have to wait for hours to cremate their family member or even return the next day.
We have waited here for the last 2 hours, but they have still not given us the time for the cremation.
A complete lockdown was announced in the entire state of Delhi from the 19th of April in order to tackle the surge in cases. The businesses are shut and workers from almost all the industries are facing severe health risks amid zero earning. The second wave of COVID-19 has hit the country hard, and as the situation is worsening day by day, the residents are unsure of what will happen next. Bhavan Goswami, CGTN, New Delhi.
Yeah, thanks so much for that report by a reporter on the ground. Now I want to bring in Professor Jeremy Kamil, Director of Viral Research for the Center for Emerging Viral Threats. And he also is an Associate Professor of Microbiology and Immunology at Louisiana State University. Professor, great to have you with us. With many countries starting to get back to normal, even with the pandemic still raging, why has India been devastated so bad?
Well, it's unclear why the second wave, as they call it, is timed exactly as it is. But with exponential growth of this pandemic viruses, it's not necessarily a surprise. It seems like perhaps people there stopped wearing masks and engaged. I've read in some political rallies and large events were held. And of course, in a country as crowded and populous as India, it's easy to see once the virus catches fire, it can become very, very hard to stop, and it can accelerate very rapidly.
And then on April 27th, the World Health Organization said the Indian COVID variant has been found in at least 17 countries. Several countries, including the US, the UK, and Australia, have put travel restrictions for those traveling from India. What is the potential impact of this strain?
I think it's too early to say much about what the strain itself means. I mean, we know that viral variants occur all around the world, and they probably have some small selective advantage. B117, which was discovered in the UK, appears to be the most transmissible variant that scientists have found so far. For me, it's hard to distinguish whether this variant is spreading around the world so rapidly simply because India, again, is a very populous nation, and there are Indian people who have excellent jobs and large families all over the world, so they're very connected. We live in a very connected world, and up till recently, flights were allowed in and out of India. So I think it's hard to exclude the possibility this variant is spreading simply because of that.
Yeah, Director Qian, let me go to you. Many neighboring countries of India are also concerned over the new variant, with Bangladesh having decided to close its border with India and extended lockdown measures. But this has resulted in heavy losses for its economy. How does India's crisis are impacting other countries? I mean, close neighbors and otherwise. Director Chen?
Yes, okay. Yeah, yes, there's no doubt. Yes, the India economy, yes, the current the COVID-19, yes, the second wave, yes, epidemic will yes cause a heavy negative impact on the economy in the South Asia countries. The first reason is that India is the largest economy in the South Asia, and is a main region, main engine of the South Asia economy. Yes, yes, and if the pandemic continues, there will be result in the disruption of the human to human linkage, and also the loss of the market demands. We can take Nepal as example. Yes, Nepal and India has free borders. The people can travel freely. Yes, and now the more and more cases found in Nepal. Yes. Come from the India, yes. And Nepal's weather from the oil and the gas and even the seaports was dependent heavily on the India. And the last thing is, given the India is the fastest economy in the world in recent years, especially before the COVID-19 years, there's a statistical shows if the India's GDP falls at 10% this year, this fiscal year, there will be yes, the world economy will be at least lose 1%. So it's a very bad news for the world economy for recovery.
Yeah, Professor Kamil, so far only 13 million Indians have been fully vaccinated. What are hindering the Indians from getting vaccinated?
Yeah.
I think,
yes.
I think the largest problem is that I think rich countries like Europe and North America are not contributing enough to solve the problem of getting vaccines around the world. There's a lot of attention on India, and we should be doing a lot more to help India. And I hope that China, the United States, Canada, Europe the wealthy nations will do more to help India, but also Africa. There's a lot of places where we don't have a lot of news coverage or testing or even sequencing for variants. And it's a very pressing human tragedy that puts the entire world at risk, in fact, because
it is putting the world at risk, unfortunately, Professor. That's all the time we have. Thank you for your insight, and thank you, Director Chen, for coming here. And with that, we come to the end of this edition of The Point. I'm Wang Guan in Beijing. Thank you for watching.